Welcome back to A More Perfect Union, the Hill's 3-day virtual festival. We're going to bring this year's festival to a close over the next hour, and boy, do we have a terrific lineup of speakers for you. We're going to talk health, and we're going to talk education. And as President Biden heads to Europe for meetings with world leaders, we're going to examine the state of U.S. foreign policy. Before we get underway, a reminder. You can tweet us at The Hill Events using the hashtag #TheHillAMPU, The Hill, A More Perfect Union. We're broadcasting live, and we'll be taking your questions, and if you experience any trouble with your live stream, just refresh the page. I'm told it will fix everything. My first guest epitomizes leadership as he continues to give all Americans a crash course in epidemiology. For almost 4 decades, he's been the director of the National Institute of Allergy and Infectious Diseases. He's become somewhat of a celebrity during the Trump administration with his candid scientific answers about the coronavirus. He's now also President Biden's chief medical advisor and shows no signs of slowing down. Dr. Anthony Fauci, it's a real honor, as always, to have you. I know that you're one of the busiest people in the world. As I look at this, and we are talking about a more perfect union, what that entails, what's a healthier nation. But I also know this is a global challenge, and this divide of, this story of 2 COVID stories, if you will, of those that are taking the virus seriously, getting vaccinated, preparing for boosters, wearing masks, washing hands. That's part of the country. Another part is not doing that. And this is reflected in a lot of nations around the world. And I guess my question to you is, how worried are you that we're going to have large populations that continue to resist kind of coming across that line and understanding that this is really deadly serious?
Well, that's a very important question that you asked, Steve. That is quite concerning. When you have a global pandemic, it has to be a uniform global response. And when you have an outbreak in a country, an epidemic, in order to effectively control it and keep your citizens safe, you have to have a very well orchestrated and implemented public health plan. And when you, as you have just said correctly, we unfortunately have a degree of divisiveness in society where fundamental public health principles that have been established for a very long period of time, the importance of vaccinations, the importance of public health measures of mitigation, when they are outright rejected by certain elements in society, that makes the entire effort less effective. So if we really want to end this and get back to, as you say, a more perfect union, we have to pull together and realize that the common enemy is the virus. And when you have a common enemy, everybody's got to pull together, metaphorically, almost as if you were in a war where it's no time to be at odds with each other. We have a very common enemy that's trying to do us in. So I would hope that as time goes by, we do better in synergizing with each other to control this, as opposed to having opposition to fundamental public health principles.
Let me ask you about this next phase that we're entering. And I guess there are 2 parts to it. As I understand, I would love to understand from you what the latest is. But on boosters, first of all, with various of the options for Americans like Johnson & Johnson and Moderna and Pfizer. And so trying to upgrade our antibodies with booster shots and bring that on, but also the vaccination of children. And what I'm interested in really is not just what the data says on what can be done, but have we learned anything from the rollout of what we had a year ago with vaccinations that helps us reach a lot of America that is underserved? We know this virus hit communities disproportionately. Are there things that we learned in the rollout that we can now apply as we roll out boosters and we roll out vaccinations to children that can help make this a smoother and more inclusive situation than we had over the last year?
Yeah, I can think of 2 very important things, Steve, that can be done. One is to make sure that you engage trusted messengers that people in society trust and will listen to when they hear recommendations, for example, to get vaccinated in the first place, or to get a booster once you've gotten your primary regimen that's been administered, as well as why it's so important to get children vaccinated, even though children, from the standpoint of statistics, don't get as nearly much of a severe involvement with the infection as elderly or people with underlying conditions. Nonetheless, a considerable number of children do get into serious difficulty when they get infected, as we know from merely looking at some of the pediatric hospitals throughout the country. So first is trusted messengers. That could be a clergy person, that could be your family pediatrician, that could be anyone that you have respect for and will listen to. The next is to make it extremely convenient and easy and very, very clear about how people can either get vaccinated in the primary sense, but also the availability of the booster shots. For example, we've recently had the FDA give an authorization and the CDC give recommendations for boosters for the three products that we have, the mRNA of Pfizer and Moderna and the J&J product. So the recommendations and the guidelines have to be very clear so that there's no confusion. And the CDC is trying to do that by making their recommendations on their website very, very clear for anyone who just clicks in to take a look at that, but also to make it very convenient. A good example of that, Steve, is that we would like to see as many children age 5 to 11 get vaccinated. So what we've done preemptively is to mobilize and get the doses in the right formulation for the children, because it's a different formulation. It's not 30 micrograms for Pfizer BioNTech. It's a third of that. It's 10 micrograms. So to get that ready in pharmacies, in pediatric offices, in pediatric hospitals, and in community centers, so that when parents decide that they do want to get their children vaccinated, it will be very easy and convenient to do so. So we've learned those two lessons from the original rollout of the vaccine program many months ago.
Great. You and I have talked about these issues in public health so many times. And I guess, it's Tom Bossert, who is President Trump's former Homeland Security advisor, who said that we were really failing on testing. He said we're focused on testing the ill. We need to test the well. If you go to Paris today, as I did recently, in Paris, you can be tested anywhere for free immediately as a citizen of Paris and get the result within 15 minutes on your phone. And if I need a test tomorrow, as I do, I can call Same Day Health in Georgetown, pay my insurance, a $75 thing on top. It's prohibitive in many parts of the country, and access, even if it is free, is fairly limited. I also, interviewed Dr. Redfield a while back on contact tracing, and so I wonder if if someone does identify with COVID, are we still doing contact tracing? He told me we were going to hire 60,000 people in contact tracing. So I guess I'm interested in where is our public health infrastructure on those fronts, and should we be doing more than we are, not just for today, but setting ourselves up for stuff that comes down the pike tomorrow?
Well, let's take testing, for example. You make a very, very good point. We right now are markedly accelerating the availability of free testing. For example, there's been now a couple of $1 billion investment in getting to the point where we can actually have available 200 million tests per month available in exactly the same situation that you said, where you will be able to do here what you were able to do in Paris, namely very quickly and easily get a test that for the most part, in most cases, not always, but in most cases could be free. So we really have to do that. But we did not have easy availability of testing a while ago, but it's rapidly improving. And then when you have that, then the issue of identification, isolation, and contact tracing fits right into line with that. So your point is very well taken. And I believe that soon you're going to see a much greater availability of easy testing.
Look, I have to ask you this question in front of our audience, which in thinking about a more perfect union, which is also to think about disaster. And folks, I'll tell you, I've asked Tony Fauci before about what keeps him up at night, what he's really worried about. And guess what? Before COVID came along, he described really most of the characteristics of COVID. I want to share our audience that Dr. Fauci has worked on Ebola, Zika, N1H1, HIV/AIDS, respiratory infections, diarrheal diseases, tuberculosis, malaria, saved millions, tens of millions, perhaps hundreds of millions of lives in HIV/AIDS, and so many other areas of epidemiological science. And I guess my question to you is, I want our audience to get an understand of what the front line of science is doing and what you worry about coming that we need to prepare for. Because we talk a lot about reacting to COVID. I think that the other bigger underlying part is science and what we're thinking about. What's the comet coming at us that's micro level that we need to really be thinking about?
A great question, Steve, and that's something that we take very seriously and are acting on. I think a good example of how fundamental investment in basic and clinical research allowed us to do something unprecedented when it came to COVID-19. And you know the story. It was the development of a vaccine that we first recognized its appearance and its genomic sequence in the first week of January of 2020. And less than 12 months later, 11 months later, we had a highly effective vaccine that was safe, going into the arms of people, saving millions of lives. When you talk about pandemic preparedness for the future, it's got to be a combination of both public health preparedness at the domestic and global level, as well as the very successful scientific preparedness that we experienced with COVID-19. And it's going to take an investment that's just not a couple of $1 billion. It's going to be a plan that we put forth that would require over a 10-year period at least $65 billion of investment, of getting interaction and transparency among nations to get a strategic network of countries and individuals who can respond literally immediately to an outbreak, so that we can get vaccines available and made in 100 days and distributed in very shortly thereafter. That's what we have to have ready for the next outbreak. And that's something that we're putting plans. You know, there's a thing, Steve, called prototype pathogen approach, where rather than waiting for an outbreak from a pathogen of a particular family, you do some fundamental core research, for example, on all coronaviruses, or all alpha viruses, or all arenaviruses, so that when you do get an outbreak with any of those families, you'll have enough core information, like a phase 1 study of a vaccine that's ready to roll out as soon as you notice you're having an outbreak. All of those things are in play right now to prepare for what will inevitably happen, and that is another pandemic.
Can I just ask you real quickly, one quick question, Tony, is if we do this interview 10 years from now, given all that you've invested in mRNA research, I'd just like to know, just speculating, and I know you don't like to speculate, but I'm going to ask you to speculate, what are some of the other diseases that we will have taken a chunk out of and perhaps rolled back, that you hope, given some of the base of research in mRNA, which has enabled us to have a chance at COVID, but what are some of the other things out there mRNA might help us with?
Well, you're speaking in a very prescient way, Steve, because that's already happening in that people involved with other diseases in which it's been problematic with vaccines are already utilizing the mRNA technology. We know that for HIV, already companies and even our own group here at NIH are doing that. Also malaria, also tuberculosis, and even interestingly, outside of the realm of infectious diseases, also immunizations and vaccinations against certain cancers in immunotherapy. So the mRNA technology was really a transforming advance in vaccinology that I believe 10 years from now, Steve, if we have this conversation, we're going to be talking about a number of successful vaccines that have emanated out of the extraordinary success of the COVID-19 vaccines.
Well, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, it's always an honor to talk to you. Thank you for all that you've done on the front of COVID and so many of these other ailments that have hit the human race. And we look forward to talking to you again. Thank you so much for joining us.
Thank you, Steve. I very appreciate your having me. Thank you.